Dr. Dana, good morning.
Good morning. How are you and Gina?
Wonderful.
Good morning, Dr. Dana.
Real good. I just have to say real quick, it's been a wonderful blessing listening to Pastor Carl, the calming effect that the Word of God can have over all of us in the most trying of times. And I think a lot of times of the different subjects that I bring to Health Matters, and these are also examples where we can turn to the Word of God when our youngsters or ourselves are infected with some of these different things that I've talked about.
Indeed.
With today's subject, I wanted to talk about something that's very common at this time of the year, and that's respiratory syncytial virus, which we will term RSV. We know that this is a virus which causes just many of our common colds and cold symptoms which we see in the cooler months of the year. Essentially, all of our children are going to have this RSV infection sometime before their second birthday. It's the most important cause of lower respiratory tract disease in infants and children across the entire world. And the importance of that is the fact that the term I used, lower respiratory. The importance of knowing about RSV for parents and us as adults is that it can create very serious symptoms in the very young infants, especially those who are at high risk, those who have evidence of congenital heart disease, premature babies, pulmonary disease children, or those children who are immunocompromised. And it can also have serious sequelae in the elderly, especially those who are over the age of 65. This next point I call being honest, because it's so important for us as adults, as parents, to make sure that we don't expose our children or ourselves to the young infants or the elderly when we know we have what we consider the common cold, which may well be RSV. We need to cover our nose and our mouths. We need to wash our hands, and we need to stay at home at times and keep our kids at home. And if that's not possible, if we're the primary caregiver in the home for, say, an infant or an older person, that's a time when you want to even pick up a mask, use good hand-washing techniques, and so forth.
Now, this is a very important point, Doctor, because especially for newborns, and in particular for any newborns that have had a challenge, for instance, at all premature, you have a lot of relatives. You've got grandparents, you've got aunts, uncles, you've got neighbors who all want to come see the baby.
Absolutely.
And that may not be the very best thing for the baby, and people have to really be honest with themselves because they may have just the common cold to them, but it actually is the underlying RSV virus.
Well, what I want to know, Dr. Dana, is there a vaccine that was created to defend against this?
There is not a vaccine per se. What has transpired is that the AAP, the CDC, have set up protocols where we can know which children are at highest risk, and there is a ongoing medication that can be given, and you can discuss this with your primary care doctor, but this can be given on a monthly basis to those babies who meet the necessary protocol. The second phase of that is that there's also, to those babies, there's about 125,000 children who are hospitalized yearly in the United States for RSV symptoms, and those children can be treated also with an antiviral drug, ribavirin, which will also help them get better.
Right.
There is not a definite preventive, in this per se, in the terms of a vaccine, which you mentioned.
Well, I can attest to the seriousness of it. Our oldest son, Jack, when he was born 6 weeks premature, and when he was only about two and a half weeks old, he developed RSV. Had to spend a couple of nights in the incubator back in the hospital.
Yes, the symptoms themselves are very important for us to be able to recognize, I think, as parents and caregivers. We need to look for, I always tell parents, a sneeze is okay in a newborn because they're clearing out their little noses. But when you hear your baby cough, that's not good. You need to take your child in to be seen. Coughing, not good. They're also wheezing. I always tell parents, put your ear down near their nose and their chest. You can hear both at the same time. Listen for that wheeze, or even pick up a cheap stethoscope. because you don't have to be a doctor or a physician to know what wheezing sounds like. And have your doctor show you what shortness of breath looks like. That chest retractions, Michael, you probably remember with your son Jack, how that his chest was retracting, his respiratory rate was elevated. And it's important, so important in infants to know these symptoms because the lower airways are so much smaller. That's why this is termed bronchiolitis, not bronchitis.
Right.
Bronchitis is what we term in older adults and so forth. But when you hear the doctor say bronchiolitis, they're talking about those smaller airways, which allow the children to be able to breathe.
That's key. That a sneeze is okay, but when they're coughing, it's the sign of something else.
That's for sure. That's for sure.
That's huge. Dr. Dana, it's a very serious topic, and we will have some links on mikeandg.com for people to dig a little deeper and learn a little bit more about RSV. And we always encourage people, if there are any indications like this, to immediately seek the help of their doctor. Always great advice. And,
thank you so much, because I appreciate it as a mom. These are just things that it's good to know and have in your back pocket, because our kids come home with all kinds of crazy things, and educating ourselves about them is exactly what we need to be doing. So thank you.
Well, good. And I just leave you with one quick thought for moms, because you just mentioned, and that is keep young infants away from large, unknown gatherings during that early infancy period. Just, keep your family close by and so forth, but not large gatherings. And when in doubt, always take your child in. The doctor's not going to get upset at you. Go take them in and have them looked at.
Right. Great advice, Dr. Dana. Thank you as always, and we hope to see you next Saturday.
Okay. Have a great week, a
Bye
blessed
now.
week.
Thanks, you too.
Bye.
Bye-bye.
Bye-bye.